So why is it important for somebody to have a colonoscopy, and at what age do you need to start doing that regularly?
That's a very, very good question. Colonoscopy is very important because it helps to identify possible abnormal growths in people's colons that they're completely unaware of. These polyps don't cause any symptoms, so there's no pain, there's no bleeding until they become very large. And most people who do suffer from colon cancer suffer from colon cancer in their 60s. And typically it'll take about 10 years. That's how long these polyps grow in your bodies undetected. We want you to get your colonoscopy done at age 50 so that we can not only detect early lesions, but prevent any cancer from ever developing.
Are there cases in which you recommend them at an earlier age?
Oh, absolutely. There are some individuals that are a little higher risk for colon cancer, particularly if you have a lot of family members that are close to you. Then you would actually have your colonoscopy 10 years younger than that individual who suffered from cancer, or at age 50, whichever comes first.
There's still probably some apprehension or fear around the procedure, but it's really not that bad, right?
It's not that bad because we do it under what we call conscious sedation. So we give you a little bit of medication to help with pain and also give you some medication to help relax you. And that makes the procedure far more comfortable. And a lot of people wake up and say, was that it? Mm-hmm. So how was your experience?
I didn't even know what happened.
Oh, good. Excellent.
So once you've done that, what are your next steps from there, once you've actually had the test?
Well, if you have no family history and you're doing it just for screening, typically you don't have to do it again for 10 years. And that's if your exam was completely normal. If, however, we do find a polyp, and even one polyp, if it is a type of polyp that does have to be followed, we're going to shorten that 10-year recommended interval to 5 years. And obviously, if we find more polyps, we find larger polyps, or something that has to be more closely followed, we're going to shorten that recommended surveillance interval accordingly.
Do you feel like people overall have become more proactive in avoiding colon cancer through these kinds of tests, or you think there's still a significant population that tries to ignore it or doesn't follow through?
I think that colon cancer awareness is absolutely essential because nonetheless, it's still the third most common cancer for both men and women. We've also tried to be very committed to educating the public by doing community health fairs, getting the word out there that colon cancer screening is absolutely essential and can save lives.
It's probably one of the few cancers that you have a really high success rate if you catch it early, right?
Sure. If, however, these growths allow to continue to grow and develop into an advanced cancer, then we're talking about, unfortunately, having decreased overall survival, having more complicated surgical therapy, and even perhaps requiring chemotherapy and radiation therapy to work in conjunction with surgery to treat it. Well, I have two patients, a father and a son. Unfortunately, the father did suffer from colon cancer, and we had to take care of that surgically. He did well, but as a result, his son had to have a colonoscopy at a much earlier age just because of the increased risk. He was 35 years old when he had his colonoscopy. Mind you, that's significantly younger than when you would go for your routine screening, but it was appropriate because of the fact that his father was diagnosed at such a young age. What happened was the son ended up having a polyp, and the polyp was removed, and he was tremendously relieved because his father had had an issue several years prior with his battle with cancer. The team that we have here is a phenomenal team. We have Hawaii's top leading surgeons in colorectal surgery, as well as gastrointestinal surgery and gastroenterologists. So what this has allowed is allowed us to work as a team together to tackle intestinal and colorectal issues.
You're pretty excited about some of the technology that you have here at the Institute as well.
Actually, one of the things that was very exciting about opening this new center is we got a bunch of brand new scopes, really state-of-the-art equipment, and these new cameras are far more flexible, so they're far more comfortable than the traditional scopes that we were using. So these newer cameras allowed for a wider angle, and so that actually increased the reliability of our exam.
Coming into this facility is very impressive. I had a choice as to where I wanted to go, and I had heard that this facility was relatively new and the state-of-the-art equipment that they had here, so I chose to come here. And I've been treated very well by the staff here.
So Robert, you're a nurse practitioner with the Endoscopy Institute, and you basically make it easier for patients to come in. What does that mean for the average person?
Basically, for a patient, if they want to get a colonoscopy, traditionally they had to go through their primary care physician. So it could have taken 2, 3, 4, 5, even 6 months just to get your colonoscopy. What we do is we allow people to just call my office directly. We'll put them on a schedule and they'll come in and see me. It's about a half-hour appointment, and then we will assess them, make sure they're healthy enough for the procedure, go through the procedure itself, talk about that, to kind of demystify it. We'll talk about the prep, things they need to do to get ready for it, and then I'll put them on the schedule of one of our 7 endoscopists.
What are some of the benefits that come along with coming to a freestanding institute like this?
Number one, time. You're able to get through the whole process quite a bit faster. We have people who will come in and see me, and I'll have them on the schedule within a week. But really streamlining the process, I think, is the first major benefit. Obviously, we also we're a really nice, up-to-date institute. We have all of the most current equipment. We have really nice surroundings, easy parking, easy location, all that kind of stuff. And I think a tremendous staff, too. That would be our other benefit, I think.
So I'm sure whenever someone comes in for the first time, they're pretty terrified, or at least not exactly excited about it. So how do you talk them through that?
And that's one of the things that I really like to do when they come see me, is I take some time to describe the process, make them confident in the procedure, that there's nothing to be worried about, that it's a very benign procedure. You also have the prep, which is the kind of thing you have to do the day or so before, where you get ready to clean everything out so the camera can see things. And I think that's probably where people are the most concerned or worried about that prep.
Do most people have insurance that covers this process?
Generally speaking, if you're over 50, your insurance will cover this procedure.
How did you get interested in this field of study?
It's something I really just found. Going through my third-year rotations in medical school, I was able to be exposed to a wide variety of different types of medicine, and I was really drawn to surgery, and under that was endoscopy. I've been able to adjust my practice and really focus on the things that I really love, which include intestinal surgery and minimally invasive surgery. Even though I've been at it for quite a bit of time, I'm still very passionate about what I do.
And why is that? What do you get out of it personally?
Actually, the key thing is that we can prevent cancer. What's absolutely very rewarding is preventing it altogether. It's like being able to reverse time.